Доброго дня, пані і панове.
Good afternoon, dear ladies and gentlemen. I'm very happy to welcome you at this wonderful event, and it's really great to know that Ukrainian Women's Congress continues and takes place even online. And today we have a unique opportunity to speak on the topics that all the society is worried about. We will speak about effective leadership to tackle pandemic. We are very happy to have the bright speakers today, and I think this discussion will be both very informative and interesting. So how coronavirus changed our life, and how do we have to move on to make sure that interests of all groups are represented and well balanced? It's a very serious question, and all the countries are thinking about this. My name is Svetlana Matvienko, Director, Ukrainian School of Political Studies, Agency for Legislative Initiatives. I'm happy to open the third discussion platform of Ukrainian Women's Congress, Effective Leadership and Fighting the Pandemic. And I would like to introduce our wonderful guests, Ms. Larisa Galadze, Ambassador of Canada to Ukraine. We are very happy to welcome you here, and we are very grateful that you found time to come here. Ms. Irina Sadovlyak, First Deputy Minister of Health of Ukraine, Katerina Bulavinova, Expert, UNICEF Ukraine, Pani Marina Honda, Deputy Chairperson of Kiev City Administration, Ms. Tatiana Semenova, Deputy Head of Kiev Regional Council, and Uliana Tkachenko, Member of Khmelnytskyi Oblast Council. Also, we're gonna have Alena Zhitko, Merchandise City Mayor at Dnipropetrovsk region. And please ask your questions on YouTube, on Facebook, and please be active in this discussion online. I think we can start from Canadian experience, and I have a very important question to you, Ms. Larisa. As we know, Canada was quite successful in fighting the pandemic. We can see it both in the culture of communication of the politicians with the citizens and in everyday communication of your Prime Minister, and all the measures that have been taken, their planning, they really they not only surprise us, but we see that it was a very well-balanced approach that helps to overcome all the consequences. So based on your own experience, can you tell about some inspiring example of women leadership that was the case in your country? Maybe some example of local authorities or volunteers or doctors who can inspire us, motivate us to fight with pandemic. Why do you think leadership is important in the current situation? How to take into account the interests of all groups, especially vulnerable groups? How can we provide them with all the necessary conditions? We are speaking here about both men and women.
You say that Canada is successfully dealing with the pandemic. I think that Canada is doing a very good job, but it will be a long time before any of us can declare success. And so, at every step, still, it's important that we are striving to do our best, and our best means thinking inclusively about how people are experiencing this pandemic and what they're going to need to recover from it, as individuals, as communities, and as a society, as an economy. Thank you for having me here today, and I want to say also that how Ukrainian authorities have dealt with this has been impressive. I think all of us had little stumblings at the beginning, whether it was PPE equipment or communications, but I think that we are now all well practiced in what it's going to take to get out of the pandemic. I'd also like to commend Ukrainian civil society for how they very quickly reacted, and I've had my own very inspirational engagement with members of civil society all over Ukraine who, and I'll tell you, mostly women, who in their work quickly realized how the pandemic was affecting their communities, those people that they serve on a daily basis, and were very quickly able to take the resources that they had, some new resources that were available to them, to address the needs of the marginalized people in society, LGBT communities, disabled communities, mothers, teachers, people in their homes. In terms of Canada, you mentioned Prime Minister Trudeau, and he has been the national face of the response in Canada. He has very much put himself in a leadership role, and in that way acknowledges the responsibility of the government, of the governments of Canada, in leading society through a very difficult time. Early on, he experienced the pandemic. I don't know if you were aware, but his wife got sick, and he looked after his children. He continued to do his job. He had no help in the house. And I think for a national leader to have experienced this at the very outset of the pandemic, I think, unfortunately, it was a way of him also getting credibility for how he thought that, how he then could understand what others would be going through. I think there's been some very inspirational leadership on the part of medical officers of health, the senior medical officers at the national level, at the provincial level in Canada, and over half of those are women. And a number of the senior medical officers of our big cities are women. It's not to say that they do the job better or worse. It's just to say they are present, and you see women leading, and the particular voice that they bring to this crisis. I think we also saw, both in Canada and in Ukraine, how very quickly women's organizations were able to raise the issue of domestic violence. Very, very early on in the crisis, it became obvious. And it became obvious because there were women's organizations who said domestic violence is increasing, and it's something that we're going to have to deal with very, very quickly. There are also unseen elements of the Canadian response that are part of our system of analyzing any kind of problem, any kind of crisis, that I think has served us very well in the pandemic. And that unseen element in particular is gender-based analysis. This discipline, this commitment that we have, this requirement that the Canadian government has, that all policy problems and all solutions and all spending has to have a gender-based analysis. What does that mean? It's exactly as you say. It's understanding how different aspects of society experience the problem and what they're going to need to get out of it. So what does a proactive approach mean? Why do you need leaders to take a proactive approach in understanding all of these elements? Because if you don't do it proactively, it's going to cost you more. You will waste money. You will waste time. And while you're wasting money and time, the pandemic will be spreading and will be having a harder impact on your marginalized communities, on women, potentially on men, depending on how you have misunderstood the problem. So a gender-based approach is one that helps us understand what people need. And if you consider the differences, you will deal with the implicit biases we have. You will mitigate the risk that it is just a random response. It's just someone's idea of what might be needed. So what does a gender-based approach tell us about the pandemic and these elements that need to be taken into consideration as we plan solutions? The lockdown meant that it drastically increased the amount of work that women were doing around the family and how much they were spending caring for family members, especially in terms of children being at home. It also the pandemic has also shown us that the central role that women play on the front lines of healthcare, on the front lines of social services. And these are women who are always there, but women who are now also bearing the brunt of the unpaid and unseen work and the extra stresses at home. Women tend to earn less than men at the best of times, and that means that they are more vulnerable to economic shocks. They are also more likely to work in an informal economy, in informal arrangements, which means they probably have less protection, like sick leave or insurance, or even the right to protection. Single mothers, Roma women, women living with HIV, women living with disabilities, internally displaced women, all these people, all these women are falling further behind, where society was trying to get them the supports that they needed. Those supports are cut off. They have had funding reduced. The leadership on them is distracted, and so you see they risk falling further behind. The LGBT community, cut off from their sources of support, often now having to spend more time in situations and in contexts where they are at best uncomfortable and at worst under threat of physical violence. Domestic violence is the pandemic within the pandemic. 2/3 of the elderly in Ukraine are women. If you don't know that, then how do you know how to respond to their needs? So I think the leadership is needed from the highest levels to demonstrate an understanding of how society is experiencing this, how society in its many variations is dealing with this. It's also needed in a systemic way to make sure that the means are there to collect the information and to use it in the analysis. And then the leadership is also needed to reach out, to not be afraid to talk to the people you don't normally talk to, and to use those networks to hear from them and to become smarter about the response that you mount as a government. So there is seen leadership, there is unseen leadership, there is leadership at the top of our governments, and there is leadership, and I've seen it myself at the grassroots level here in Ukraine, just as there is in Canada. And so we all need to take a proactive approach, because if we don't, who will?
Thank you very much. Actually, what I liked most, what I was impressed most with, is the leadership that has to be systematic. This is what we have to learn, how to be systematic, and this is a very important point. Thank you very much for your speech. We move on. I am happy to introduce Ms. Olena Zhitko, Marhanets City Mayor, Dnipropetrovsk region. And I hope our viewers remember they can ask their questions, and then we will ask them in the end of our panel to our speakers. Miss Olena, good afternoon. Good afternoon. We are happy to see you with us. So what we expect to hear from you, of course, about your personal experience, how you personally were fighting with pandemic locally, and about the experience of your city, how you managed to cover the needs of different types of citizens, and which tools you used. and which tools other city mayors and other leaders can use later on in their work. I'm very happy to share the information. I would like to say that a city is an amalgamated territorial community, and also there are 6 villages that were joined to our territorial community. The area of our city is quite big.
But by the number of population, we have 50,000 of inhabitants. For us, as for all Ukrainians, the pandemic has been a huge challenge. But we did our best and started step by step tackling all the issues that we faced. The most important what I see in such cases for our citizens, the most important is information, daily briefings, daily information. That is why we made the decision, I personally and our secretary, when I am absent, we informed daily our inhabitants about what is happening. We are constantly in touch with health workers, with those people who work at the front line of the fight against the pandemic. We also introduced a so-called program about providing information. That is why people have the opportunity to get to know more. For those who are not connected to the internet or who don't have the time to watch our briefings, there is newspaper, local newspaper in Marhanets, and we also publish different leaflets. Every Saturday we publish our news. We provide information from our health workers of the primary and secondary care. In this case, we have gender equality because at the front line we have not only women but also men. Our emergency services is led by a man, but the results, our sanitary doctor is also a man. It was difficult to start this work because of this distribution into primary and secondary health care was difficult. Everybody wanted to say, this is not my responsibility, I'm not responsible for that. In order to tackle that issue, we often organized trainings and joint meetings to develop a scheme, what we will do if we will have a spike in the pandemics in number of cases. We developed a scheme, a plan, which we'll be able to use. But fortunately, right now, we've only had 2 cases of COVID-19 so far. The first case was quite incredible, was quite surprising. There was a pregnant woman who gave birth to 2 children, but unfortunately, she got sick and she lost one of her babies. We managed to help her. Another case was with a man who got to our hospital from a hospital in Zaporizhia. So we had this time and we used it to learn how to fight the pandemic, to work out an efficient plan of what we will do in case of a spike in cases. Now we are in the so-called green zone, but we are always ready for a spike in the number of cases. As for our experience in fighting the pandemic, I would like to say that this is the experience of cooperating with our businesses. We have coal mining and coal enriching enterprise. They helped us on the first stage of the lockdown. They helped us buy masks, disinfection liquids. They also helped us in purchasing artificial ventilators. We were also heard by our neighbors, Nikopol Enterprises, Interpipe, Nikatube. They also helped us. They provided us with a huge number of disinfectants as well as different technical equipment to fight the pandemic. We provided all the health workers with personal protection suits so they can visit those places where there might be sick people, so they are fully protected when helping people. In my opinion, the most important in fighting the COVID-19 pandemic for any authority is to be the leaders. And we need to do our best to prevent panic. People always look for the government, for the authorities, for support. That is why we need to be confident, we need to be strong, to be able to inform everyone, to provide everyone with what they need. Let me reiterate that it is very important to provide enough information, financial support. This is what, unfortunately, we don't always have in difficult times of development of our country and our city. And also moral support is very important. That is why in order to do our best, we need to inform people in any cases, in any crisis situations. This is what I think. In my experience, I see that in provincial cities and towns, but I think it is also relevant to the capital of Ukraine, there are a lot of fakes, of incorrect information all over the social networks. It impacts the mental health of people. In difficult cases, it is very important to maintain good mental health. Thank you so much for your information. We understood that it is very important to raise awareness. Thank you so much for contributing to our discussion and for your joint efforts that you made when fighting the pandemic. Thank you so much. We need to proceed in a more interactive regime or format, so our viewers have the time to ask their questions after the discussion. And now I would like to ask Irina, as we know, Ministry of Health of Ukraine is at the front lines of fighting against the pandemic. There were a lot of challenges that your ministry faced. These are leadership challenges. We know that we have a new Minister of Health, but there were other changes, informing about the lockdown measures, working with people, informing and supporting healthcare workers all over Ukraine. So I have the following question. This crisis showed that we have a lot of problems in our system of public health that need to be tackled. So what would you like to share with us? What shall be taken into account for the future? So in case of such a crisis, of possible crisis situation, we do our best in informing all the population, men and women, about different challenges. Did you use gender approach in your work? How did it happen? And was it important to you? Were we ready for this crisis? Yes, that's true. There are a lot of challenges for the healthcare sector because our doctors, our nurses bear a lot of responsibility to protect the health of those people who get sick. We also have to prevent people from getting sick. When I was getting ready for this discussion, I analyzed how many women are there in medicine. Well, they make the biggest part of healthcare workers. There are 63% of women among doctors and 93% of women among the nurses. That is why, yes, of course, women bear the majority of the responsibilities. A lot of women had to leave their families in order to carry out their professional duties. After the onset of the pandemic, outset of the epidemic, they had to be responsible for destiny, for health of each patient. And I think this is what helped our medicine, our healthcare system. This is what helped us save a lot of lives of Ukrainians. Because, as you know, there are a lot of COVID-19 cases, but at the same time, health workers did their best. to help them. And right now, the death toll in Ukraine is among the lowest in Europe and all over the world. It means that we are very responsible to all that has happened. But of course, COVID-19 pandemic has worsened all the problems with equipment, with personal protective equipment. It was a huge challenge for us. But I would like to say that our team of the Ministry of Health, responded promptly to all the problems that arose, that we faced. It seems to me that we are a single sphere in Ukraine that every day tackles these issues, we do our best to inform the population. The Ministry of Health briefs the population daily. We provide correct statistics about the number of cases. It became possible to everyday work, to daily work of each and every healthcare worker in Ukraine. This is very important. This is a hugely important work that they did. And now I would like to say that we are more ready than ever to face new challenges. We know how to overcome them, but we have a lot of work to do. Every day, every minute, every second is important when making such decisions. We wish you every success in your daily work. Thank you so much for your contribution in fighting the pandemic in Ukraine. And our next speaker is Tatiana Semenova. My question is the following. You are first deputy head of the Kyiv Regional Council. We know that people have different opinion to the government activities. There are 50% of people who are happy and 50% who are not happy with the government response. So what is your personal experience of responding to such problem, for example, as domestic violence? Because the lockdown has worsened this problem. There were a lot of women and men who had to stay at home. What would you tell us about it? How Ukrainian authorities tried to tackle this issue? Mothers, women during the lockdown faced with the challenge of having to care for their children at home. All the schools, all the kindergartens were closed. They had to think where to find money, how to feed their families. We see the statistics. We see, unfortunately, a spike in the number of domestic violence cases when a family has to stay behind closed doors. We know that it's very difficult. We know that in spring and April, it was recommended by the Ministry of Health to stay at home. A lot of people lost their jobs. A lot of employers forced these women to work from home. That is why there were a lot of that is why what we did to tackle that, we explained all the lockdown measures. We introduced a hotline to help people, to help women. There were a lot of social workers working in Kyiv and in Kyiv regions, so women who had such problems knew where to seek support. I would like to say thank you to law enforcement agencies because they also provided their help, their support. Unfortunately, in Ukraine, we don't have such a practice that a woman can report her husband and punish her husband. Unfortunately, we don't have such practice. Usually, the police just talks to this man, and then he goes back home and does the same. Everyone suffers. Women suffer. Children suffer. What can we do? I think we women need to get together to discuss it, to create documents, so all we men know that they don't have the right to hit their wives or even abuse them emotionally and psychologically. Yes, of course, it is a high time to mention Istanbul Convention. I do hope, personally, and I hope that my colleagues will support me, that Ukraine finally needs to ratify this hugely important document in order to move into the same same civilized approach and be able to tackle all these issues more efficiently. Thank you so much. The next question is to Marina. Please tell us. A pandemic has not only global but also local consequences, because you work in the Kiev city administration and because Kiev is quite a problematic region, problematic spot on the map of Ukraine. Kiev city authorities reacted quite well at the outset of the pandemic. You were among the first to impose lockdown measures. So, which experience would you like to share? And, of course, gender aspect is very important. Maybe gender budgeting. How did you think about vulnerable groups of women and men? And what tools did you use in order to tackle these issues, to overcome those challenges? I would like to hear your evaluation about domestic violence as well.
A lot of questions, and I have to give brief answers. We still have a little bit of time. Okay. Well, Kiev is a very difficult city. A lot of people, 1,300,000 people are not registered in Kiev, but they live there. And it's the issue of leadership, something that could help quickly address the issue. We understood that people will stay at home. Pensioners, single moms, moms having a lot of children, they will stay at home. There will be a lot of people who will lose their jobs because they were not working officially registered, and we understand that we were not able to wait. We were not able to wait for some budgets, some state programs, because it takes a lot of time, and a very serious decision was taken, and I know that our experience was accepted by international organization. We created a coordinational center of volunteers, everyone who wanted to work in Kiev. We combined it with our social services, and in 2 months we did everything possible to provide people with products, with food, we provided transport for people who couldn't get to hospitals. We were buying different hygiene items for women with children because they couldn't go outside. They were staying home with their children. We just had to mitigate the situation with shock, and we had to take decision very quickly. But frankly speaking, for me personally, and maybe for everyone who is here, coronavirus showed the real huge gap, gender gap in reaction to coronavirus. When you lose your job, and we were able to see this difference between the social services that a man is to receive and a woman is to receive. It turned out that there were a lot of issues we didn't pay attention to. In the beginning of confinement, we have 22,000 families in hard life circumstances, and in 2 months after quarantine we have 60,000 of families. No money. If it's a single mom and she stays at home with her child and she's not receiving a salary, it means the city budget have to take 2 people on balance and help them. So we try to take this into account to make gender-based budget, not like man and woman, but when we allocate funding, we see what kind of needs this particular person has. We didn't have that splash of domestic violence in Kiev, unfortunately. We had some questions with from men who felt suicidal. We opened the hotline. We didn't expect it, but a lot of people just moved out of Kiev who were not registered in Kiev or who had some relatives. And when we didn't actually observe a big increase of domestic violence, but a lot of people called us and told us that confinement gave us possibility to address family problems, and we were very happy about it. And we opened a crisis room, and with the support of the Embassy of Canada and funding of the Embassy of Great Britain, we do a lot, and I'm very grateful for this support. And this issue of women who experiences violence at home is really very pressing. We're still not speaking enough about this. So we received a lot of women. The oldest one was 73 years old. She was beaten by her son. And I would like to say that this confinement showed gaps, showed these blank spots in our social sector. We thought that social sector, pension subsidies, our social services was not very fine adjusted, and we are happy we are having this forum, because to start understanding what gender is, we have to explain this. We have to explain to people who work in social services that it's not just about men and women, it's about specific service that a person needs. So we have this understanding at the general state level, but we don't have this understanding locally. So we need a huge awareness campaign, and we see the experience of our European colleagues, and they spend a lot of time and efforts, and we need this campaign, and it will be much easier to develop the proper budget and to address the real needs. Thank you very much, and I would like to give the floor to a person who would be able to tell about the effective leadership on a local level, Ms. Ulyana Tkachenko, member of Khmelnytskyi Oblast Council. Ms. Ulyana, what did you manage to do? How you were doing this? Was it effective? And I know that you've implemented a project and you would like to share results with us. What did you do at your local level? Good afternoon, dear colleagues, dear visitors of the forum. As I'm not a doctor, I've been to hospital only as a patient, but when coronavirus started, I had to become a woman leader. I had to be responsible in the region for the headquarters to fight coronavirus, to cooperate with business, with local authorities, and business was supplying the regions with all necessary to cooperate with communities, with people, with voters who were calling, and they were saying, tell us the truth, what is actually happening, does this virus exist or not? So when I had to be head of the headquarters to fight the coronavirus, next morning I gathered a big meeting with the representatives of authorities and doctors, and the main infectionist doctor in our region is Ms. Tatiana, and she is the head of in the region. And when I met her, I understood that she's very self-confident. She knows what she's doing, and our region is in good hands. And we all understood that we have to protect the region. We have to stop spreading panics and stop spreading virus. Unfortunately, our healthcare sector, social sector was not ready for the pandemic. And we received a list for procurement list to supply everything necessary. And us as women, we thought, what is the most important? Children. We have to save the children. So the list is very good, but let us invite the doctors who are the head of the hospitals, and we will ask them, do you need this, or maybe you have this but you lack this. And the sanitary doctor, he informed us, he said, we're the only region that doesn't have amplificator. This is the device that is needed to make the coronavirus test results. So we decided that we need to get amplificator for our region. And we say, okay, we can ask business to buy this device, so people don't have to go to neighboring regions to make tests. Our region should have this modern equipment, and we rearranged the list, we rearranged our needs, and thanks to business, which is able to react faster when it comes to buying something, we had the amplificator very quickly, and it was able to process up to 900 tests per day. And there were a lot of other things which we did with the chief doctor and with other women and men were just listening to us, and they were saying, yes, we agree. They were kind of leaders, and we led them to take decision, because the head of the regional administration is a man, a lot of other heads are men, but I would like to say, as our colleague said, in healthcare we have more women than men. Also in education we have more women than men. And yes, we had to take a lot upon our shoulders, and we have to move on with this weight. And I think we managed, because we were brave enough. And in the period when everyone were scared even to go outside, because, mass media were telling that it's dangerous, us women and men, we visited every hospital, every laboratory. And I, as a member of parliament, I went to my electors, I was giving out masks, I was communicating. And, in the cities, people are more well-informed. When you come to the village, they say, yeah, we heard about virus, but tomorrow we have to do a lot of work before the Easter, and we will come together and do the work. And we were explaining them, no, stay at home. It's for your own safety. It was uneasy. Yes, a lot of people had problems because they were without work. They had to stay at one place all together. I had a mission. I was on business trips all the time, all over the region, and I didn't sit at home. So for me, the confinement was difficult in other way, because it was a lot of load, difficult logistics, responsibility. You have to be strong. You don't have to show that you also have some fears, that you're also mom and wife, and you have to go back home healthy, and you have to go back home actually. And after all these days in hospitals, as to the project and overcoming the challenges, well, let's go to the next issues, and maybe there will be more time during Q&A session. Ms. Katerina Bulavina, UNICEF expert. The question is, based on your experience and from your evaluation, how leadership in the Ministry of Health Care was in place? Can you evaluate this? And how coronavirus crisis influenced women working in healthcare sector? What should we do to protect them even more? And how would you distinguish the influence of pandemic on men and women? It would be incorrect to say who suffered more, but I just thought, am I able to remember such number of questions in 3 seconds, but let me try. Well, we have a good leadership in ministry. Yes, our minister is a man, but the deputy ministers are all women. And the heads of the departments are also women, and we have a lot of women regionally, so it's a women's sector, not only because we have a lot of nurses who are women, but also we have a lot of women leaders. I don't think I'm quite competent to evaluate the work of ministry. I don't think it would be correct, but speaking of leadership in the current situation, I think it's a big challenge for any leader. He has to ask the main questions like, is human life a main value or not? We have problems. We have problems with valuing human life. We can see it in healthcare, we can see it in ordinary life, and COVID showed this. People who have some diseases, long-term diseases, and elderly people, they are, have bad health conditions, but due to COVID, they become even more vulnerable. And as Ms. Ambassador said, 2/3 of the elderly people are women. So my question is whether the human life is a value or not. And if we answer these questions, it will influence the decisions. What I also expect from leaders is to be honest, because crisis is a very bad moment to lie. There is a big habit to lie about everything.
To say that everything is okay, it seems to me that this is a very bad moment for lies. It is an excellent time for truth. It means that we need to be completely true with ourselves, with our colleagues. Because if you lie, when you tell the wrong things, you will have problems with people trusting you. And I think another important aspect of leadership is empathy, because right now everyone is afraid. There are no people who are not afraid. Doctors are afraid, nurses are afraid, families are afraid. They are also afraid of different problems when they get back to the villages after treating people in big cities, and local inhabitants are afraid of them. That is why we need to talk about that, to talk about those leaders, to make those leaders discuss those fears with local inhabitants. This distance between the authorities and between people is very bad. I would also like to make the leadership not vertical, but more horizontal, more supportive. We need to support people. As for women, in healthcare sector, of course, it is a major female-led sphere. That is why they suffered most. COVID-19 impacted such implicit spheres as, for example, partnership, different maternity leaves. There were a lot of people who were not led to childbirth with her partner. It is very important to let partners go with women to give birth. There were different problems with women's consultations in different towns and villages. These are the services which are very important to the entire family, not only to women. It seems to me that these are the key aspects which are important in this situation. I would also like to say that we have huge problems with death toll, with death related to COVID, with how relatives are informed about the death of their relatives, about funerals of people who died from COVID. I think we need to work with that in order not to traumatize people additionally, because death is cruel, is bad in itself, and we don't have to aggravate this process. Thank you so much. I would like to thank all of our viewers for a number of questions that you post online. We will ask 2 questions to our speakers. The first one is from Larisa Verbitska to Marina Honda. The question is related to opportunities to open a second crisis room. You told about your plans to do that. So when exactly do you plan to open this second room, and will there be mobile units in Kyiv? Well, yes, Kyiv is a huge city, and it is very difficult for police in cases of domestic abuse to get those abused women from the left bank to the right bank of Dnipro River. That is why by the end of this year we plan to open this second room. But according to our statistics, we need at least 4 rooms in order to meet the demands. And there is a second question from Natalia Cheremoshentseva. How women are involved in working in these operative headquarters to fight COVID? And so the question is again to Marina. What do you mean by headquarters? Headquarters to fight COVID. We have single headquarters and we have district headquarters as well. That is why all the representatives of the community of the city can take part in the work of these headquarters. We created the single coordination center because a volunteer work network in Ukraine is quite wide and developed, but we need to understand the demands, the target audience. That is why we decided to unite all of these networks, all of these directions. We distributed 60,000 food baskets to all the people who needed them. We provided a lot of help to different people. That is why any civil society organization who wants to join our efforts, they can join us. And now I would like to ask our speakers to sum up. I will give each of you about 30 seconds to say your final words in a sentence or 2. What would you like to say to all women and men to inspire them to continue the fight against the pandemic? Let's start with Larisa. 30 seconds. Thank you so much for inviting me.
What I would say is that when crises arise is not when you suddenly have faith in government institutions and in political leadership. That it is the faith in political leadership and the faith in your public institutions and the excellence and the things like gender-based analysis that people know how to do at regular times that helps you get through the crisis. And so thank you and continued encouragement to everyone who's working on this crisis, but also continued encouragement to everyone who is trying to reform their institutions, to build capacity so that it is there in the system and the system is able to respond in whatever kind of a crisis situation.
Thanks so much for having me here. I would like to wish everyone not only to listen to statistics every day, but to meet those requirements and stick to those recommendations of the Ministry of Health. I wish you good health. I think this is the most important. Everything will be fine. Don't worry. We need to make everyone sure that all the health workers really love every patient that they care for, despite the fact that there are a lot of problems. But human factor is very important. They have empathy. They have sympathy for people's problems. This is what will help us overcome this problem. Well, first, if you are a leader, if you need to take a look at behaviors of women, because you will understand what they need and you will be able to provide them proper recommendations in order to save their and your lives. So you need to understand the needs of women who work for you if you are a leader of an organization. If you don't understand what barriers they face face, you will be in a trouble. I would like to thank all the women health workers. Thank you so much. Try to be as good as possible to all the patients that you care for, because they are there in the hospital without their relatives and they are afraid. You had a question about leadership. COVID showed that we don't have to distinguish between men leaders and women leaders, but I would like to say that leaders are just leaders. There are a lot of women leaders all over the world. When women are leaders, they are as efficient as men leaders. Secondly, I would like to say that we need to use this situation, this moment, in order to solve systemically those problems that worsened during the pandemic. Because if we will have more waves of the disease, more crises like that, we won't be able to overcome them. And I would like to thank business organizations, executives, civil society organizations all over Kyiv Oblast for our joint efforts in fighting COVID-19. I would like to say thank you to health workers, to doctors and nurses over the base hospitals that treat people with COVID. Kyiv region fights very well the pandemics, and statistics speaks for itself. I would like to wish everyone patience, kindness, and man, please listen to women's intuition. It is a very powerful force. I would like to thank our speakers for their time, for their contributions to our discussion, and for all the important things that they said. And now I would like to welcome on stage Maria Ionova, an MP of Ukraine, and one of the initiators of the Ukrainian Women's Congress. Maria will have the chance to close our Congress and to read the resolution of our Congress. Thank you so much, ladies and gentlemen. I would like to thank all the speakers and moderators for their examples, for the stories they shared, for such an excellent discussion. I would also like to thank our visitors, our guests who watched us online. This Congress has become possible thanks to our partners and like-minded souls. Our world has changed. COVID-19 has not only changed the lives of everyone, but it gave us the opportunity to get a better look at all the problems, to face challenges, but to understand what kind of steps we can do to overcome them. Ukraine can be very proactive in fighting the pandemic, and it shall continue going into this direction. Women's Congress makes public discussion about new opportunities more relevant. We need to create a safe and secure environment for lives and development of men and women. It is possible only due to efficient political leadership at all levels. After our Congress, we sum up, we write our resolution, a final document. It contains recommendations of our international partners. These recommendations are related to fighting the pandemics as well as to elections, which will happen in October in Ukraine. Political parties, election commissions, and other parts of the election process shall stick to gender quotas, shall create equal, non-discriminatory opportunities for women to be active in politics, to counteract sexism, especially in the media. Organization of local elections shall meet all the requirements of security, safety, and hygiene. Secondly, It is very important to take into account in all state politics, to take into account all the needs of all groups of women based on national and international commitments which regulate equality between men and women and human rights. You will be able to read the full text of our resolution online on our website. Our today's topic was new opportunities, new realities. I call on all of you to read it, to share it, and to implement it, because every man, every woman has the opportunity to act. As we always say with Ilona Kondratyuk, together in a partnership, we will be able to reach equality in politics. So let's be active, let's be responsible. We are nearing the end of our interim Congress online. It was held online due to the lockdown measures. Thank you so much for being so creative. I am grateful to our informational and international partners, especially to Star Media. Thanks a lot. See you at the first International Women's Congress in December. Stay in good health. Thank you.